A new study has discovered that coughs can potentially travel up to 12 feet, around 3.6 meters, if unobstructed, much further than the new 1 meter social distancing guideline. So let's jump into the video to see about coronavirus infection and signs of cough and sneeze. We publish good content videos every day. If you're not subscribed to this channel since, don't forget to tap the subscribe button below, otherwise I will notice you. The best face masks for stopping the spread of COVID-19 are well-fitting cone style and homemade versions made from multiple fabric layers. Researchers analyzed which were the best and worst face masks for minimizing the spread of droplets from coughs or sneeze to mitigate the transmission of the virus. Tests showed that the least effective varieties were loosely folded face masks and bandana style coverings, which provide minimal stopping capability for respiratory droplets. The study published in the journal Physics of Fluids also discovered that coughs can potentially travel up to 12 feet, around 3.6 meters. The pathogen responsible for COVID-19 is mainly found in respiratory droplets expelled by infected individuals during coughing, sneezing, or even talking and breathing. This explains government's rationale for recommending face coverings to reduce the risks of cross-infection from infected to healthy individuals via respiratory droplets. On June 15, the government made face coverings compulsory for people using public transport in England. Despite this, the authorities have not yet announced guidelines on the best varieties of masks to curtail the spread of COVID-19. Study lead researcher Dr. Stella Batalama at Florida Atlantic University in the US said, "Our researchers have demonstrated how masks are able to significantly curtail the speed and range of the respiratory droplets and jets. Moreover, they have uncovered how emulated coughs can travel noticeably farther than the currently recommended distancing guideline." The research team used a technique called flow visualization in the laboratory setting, in which they used a mixture of distilled water and glycerin to generate a synthetic fog to mimic cough droplets. They used a mannequin to stimulate coughing and sneezing. Before visualizing droplets expelled from its mouth, they tested a range of masks that are readily available to the general public and which do not deplete medical grade masks and breathing devices that are vital to healthcare workers. Among the tested masks included a single layer bandana style covering, a homemade mask that was stitched using 2 layers of cotton quilting fabric, and a non-sterile cone style mask that is available in most pharmacies. By placing these various masks on the mannequin, they were able to map out the paths of droplets and demonstrate how differently they perform. Results showed that loosely folded masks and bandana style coverings provide minimal stopping and capability for the smallest respiratory droplets, whereas well-fitted homemade masks with multiple layers of quilting fiber and off-the-shelf cone style masks proved to be the most effective. They were able to significantly curtail the speed and range of these respiratory jets, albeit with some leakage through the mask itself and from small gaps along the edges. Without a mask, droplets travel more than 8 feet or around 2.4 meters. With a bandana, they travel 3 feet 7 inches or just over 1 meter. And with a folded cotton handkerchief, they travel 1 foot 3 inches or just under 40 centimeters. Cough droplets travel just 2.5 inches of just over 6 centimeters when covered by a stitched quilted cotton mask. And with a cone style mask, droplets traveled about 8 inches or 20 centimeters. Study leader Dr. Siddhartha Verma, an assistant professor at Florida Atlantic University, said, "In addition to providing an initial indication of the effectiveness of protective equipment, the visual used in our study can help convey to the general public the rationale behind social distancing guidelines and recommendations for using face masks." He added, "Promoting widespread awareness of effective preventive measures is crucial at this time, as we are observing significant spikes in cases of COVID-19 infections in many states, especially Florida." Importantly, uncovered stimulated coughs were able to travel noticeably further than current distancing guidelines. When the mannequin was not fitted with a mask, they projected droplets up to 12 feet or 3.65 meters within approximately 50 seconds, and the traced droplets remained suspended in mid-air for up to 3 minutes in the surrounding environment. The researchers said their observations suggest that current social distancing guidelines may need to be updated. The unobstructed turbulent jets were observed to travel up to 12 feet. A large majority of the ejected droplets fell to the ground by this point. Importantly, both the number and concentration of the droplets will decrease with increasing distance, which is the fundamental rationale behind social distancing. Apart from COVID 19, respiratory droplets also are the primary means of transmission for various other viral and bacterial illness such as common cold, influenza, tuberculosis, SARS, and MERS. These pathogens are carried by respiratory droplets, which may land on healthy individuals and result in direct transmission. When the pathogens land on objects, they can lead to infection when a healthy individual comes in contact with them. Their research outlines the procedure for setting up simple visualization experiments using easily available materials, which may help healthcare professionals, medical researchers, and manufacturers in assessing the effectiveness of face masks and other personal protective equipment qualitatively. So, I hope you guys enjoy this video. Please make sure to click the like button below this video and subscribe to the channel.